Good day, everyone, and welcome to Elena Vein with Don Simple. Today, I'll be talking about PTSD, that's post-traumatic stress disorder. What is post-traumatic stress disorder? This is a mental health condition that can develop as a result of someone's experience or someone who has witnessed a traumatic event. This is a mental health condition that develops after a traumatic event, and that is why it is called post-traumatic stress disorder. Now, this event might include a lot of things. It might be war, it might be natural disaster, it might be relationship breakups, it might be accident, physical or sexual assault, or any other situation that feels life-threatening. And we'll be looking at the key symptoms of PTSD. The reason why we are talking about post-traumatic stress syndrome is because a lot of people find themselves in this category. After an event might have occurred in their life, they still find themselves glued to the image of these things that has happened in their life, and it has a way of negatively impacting in their day-to-day life. So we'll be looking at some of the key factors, some of the key symptoms of PTSD. One, it includes intrusive thought, such as flashback, sudden panic attack. When you find yourself in a situation where you have this intrusive thought of certain things that have happened in the past, maybe an accident, a traumatic event, physical assault, sexual assault, and you find yourself having a flashback of this thing. This is also known as intrusive thought. Then when you find yourself in a position where you have sudden panic attacks, it means you have PTSD. Another symptom of post-traumatic stress disorder includes avoidance. Take, for example, an accident occurred while you were driving, and you find yourself having this fear of driving. Every time you get into a vehicle to drive, this sudden panic comes, this sudden trembling, fear comes. It means you are experiencing a PTSD, a post-traumatic stress disorder. Another symptom of this PTSD could be hyperarousal. You find yourself getting hyperactive, hyper-aroused when you have a sudden flashback on certain things that have happened to you. Being easily startled. Maybe when you hear some noise, when you hear or someone calls your name, you find yourself feeling tense. You find yourself feeling uneasy at the sound of certain things. This is also a symptom of PTSD. Another symptom is negative changes in thought or mood. When you find yourself having this feeling of guilt, sometimes when an accident occurs, sometimes we are not the victim. It could be the accident occurred as a result of our recklessness or our carelessness. Now, when you have this negative change in mood, negative change in thought, with a sense of feeling guilty, it means you have post-traumatic stress disorder. So you need to seek a mentor. So we'll be looking at ways to handle a post-traumatic stress disorder. First and foremost, you need to involve a professional, and that could come in form of therapy. You need to seek a therapeutic solution to that particular problem. Another way to handle this includes their basic aspect of seeking professional help. One of them is cognitive behavioral therapy, which is an area I am an expert on. And also, you could also seek a prolonged exposure therapy. What do we mean by prolonged exposure therapy? You find yourself gradually exposed to the things that are related to the things that causes this PTSD. If you are the type that, you had an accident on a particular road, and because of the fear, because of that stress disorder you have, you avoid that particular road. One of the treatment towards getting you off that particular thought is having to expose you to that, what we call prolonged exposure therapy. You visit this place from time to time in order to combat that fear. Another way of treating a PTSD is eyes movement desensitization. Eyes movement desensitization and reprocessing, which involve guiding your eyes movement to help reprocess traumatic memories. Now, how do you do this? It's called, in medical terms, it is called EMDR. That is eyes movement desensitization and reprocessing. How do you do this? By constantly having this eye movement where you use your eyes in helping yourself reprocess traumatic memories. Then you use your eyes. You could be shutting your eyes, you process it, and you come out of it. It has a lot of ways of that one. Then we also, another major help is self-care and daily habit. Now, you practice grounding technique. One of the major things I do tell people is when you are experiencing PTSD, initiate a self-care and daily habit. One of these daily habits could be deep breathing, could be mindfulness, it could be focusing on your surrounding, it could be staying active, doing things that gives you joy, doing things that takes your heart off the memories of what would have happened. Then maintain a particular routine. This routine should be something that helps you come out of depression, helps you come out of that mental thought that will make you feel traumatic, that will traumatize you. Another one is get enough sleep. PTSD often affects sleep, so create enough time to rest. Create enough time so that your body and your brain will be relaxed. By so doing, you will be able to, to get yourself out of this situation. And lastly, a lot of people resort to drinking and taking of drugs. Now, I will tell you for free that drugs and alcohol are just temporary solutions to permanent problem. Now, when you resort to taking drugs, when you resort to taking alcohol, what you succeed in doing is you create a temporary solace to something, to a recurring problem. So avoid alcohol and avoid drugs. If you take these practical steps, with time, you would realize that you are getting better and better. Don't forget, the first major step to take is seek professional help, which involves seeking the services of a cognitive behavioral therapist, a mental health therapist, and you follow all these outlined steps I have, mentioned to you, and you would realize that as each day passes, you get better and better. Let's help keep the world a better place. Thanks once again for joining. My name remains Don Simple, and this is a platform where we offer hope and healing, emotional healing, traumatic healing to people all over the world. Do have a wonderful day.